When we talk about hormones in menopause, we're really talking about three key hormones: testosterone, estradiol, and progesterone. And women will actually lose those hormones fairly gradually over their lifetime until they're in menopause, and then they really quit producing all estrogen, all progesterone, and half their testosterone. And so when we're talking about replacing, we want to replace those three hormones. Women can safely stay on hormone therapy for their entire lives. No more do we have to think about taking it for a bit of time and then stopping it. As long as a woman doesn't get a contraindicated condition like breast cancer or cardiovascular disease or a stroke, she can safely stay on hormones for her entire life. And then as we notice what a patient her symptoms are, then we can address what kind of hormones that she needs. Not everybody needs estradiol right away. Many women do not need estradiol until they're in their late perimenopause or actually go through menopause. They need progesterone first. And progesterone is a hormone that allows us to sleep. It keeps the lining of the uterus thin, and it's actually anti-inflammatory. So women benefit from progesterone even if they don't have their uterus. It's a really beneficial hormone. When we are deciding with a patient on what hormone therapy that they want to use, we will counsel them about risk versus benefit of that particular therapy. For instance, estradiol can be taken by mouth, or it can be taken through the skin, or transdermally is the term we use. When we use estradiol orally, that can increase a woman's risk of stroke. It can also lower her testosterone even more than it's already lowered at her age. So we prefer women use transdermal therapy or estradiol through the skin. What's great about that is there are a lot of choices. They can use a patch, they can use a gel on the arm, a gel on the leg, a ring in the vagina, or a spray on the arm. So those are all great choices for a woman as she's choosing her estradiol therapy. For progesterone, there's really only one option. It's an oral pill form. It's taken at night before a woman goes to bed because it actually helps her sleep. And the other thing that progesterone can do is it keeps the lining of the uterus thin, and it also is anti-inflammatory. The progesterone therapies that are currently available do not have elevated risk for stroke. The confusing thing sometimes to patients is all hormone therapy is labeled exactly the same way. So the packaging that comes when you get it from the pharmacy says may increase your risk of heart disease, stroke, breast cancer, and dementia. And so what's really important from our standpoint is we have a conversation about what that package labeling means, where did it come from, and is this individual patient at increased risk for any of those?